Which complication is most likely if a patient's dialyzer is not primed properly before treatment? A. Electrolyte imbalance. B. Air embolism. C. Hypertension. D. Muscle cramps. Answer, B. An improperly primed dialyzer can introduce air into the bloodstream, leading to air embolism, which is a life-threatening complication. During hemodialysis, which condition is indicated if a patient develops tingling around the mouth and muscle spasms? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypoglycemia. Answer, B. Tingling and muscle spasms are classic signs of low calcium levels, hypocalcemia, which may occur during or after dialysis if calcium balance is disrupted. Which dialysate temperature is considered safe to minimize risk of hypotension? A. 39 degrees Celsius. B. 36.5 to 37 degrees Celsius. C. 40 degrees Celsius. D. 35 degrees Celsius. Answer, B. Standard dialysate temperature is maintained around normal body temperature, 36.5 to 37 degrees Celsius, to prevent overheating or increased risk of hypotension. A patient begins to complain of chest pain during dialysis. What is the first action the technician should take? A. Stop ultrafiltration. B. Increase blood flow rate. C. Call emergency services immediately. D. Administer oxygen as ordered. Answer, A. Stopping ultrafiltration reduces fluid removal and may stabilize blood pressure, giving time for further evaluation and emergency support. Which vascular access has the lowest infection risk for hemodialysis? A. Tunneled catheter. B. AV fistula. C. AV graft. D. Subclavian catheter. Answer, B. An arteriovenous fistula is the preferred vascular access due to its durability and lowest risk of infection compared to catheters and grafts. When monitoring venous pressure, a sudden increase indicates what complication? A. Air embolism. B. Blood clot or kink in line. C. Low blood flow rate. D. Ultrafiltration too high. Answer, B. A sudden rise in venous pressure typically indicates obstruction in the venous line, such as a clot, kink, or needle displacement. If a patient complains of a throbbing headache near the end of dialysis, what is the most likely cause? A. Dialysis disequilibrium syndrome. B. Hyperglycemia. C. Fluid overload. D. Hypertension rebound. Answer, A. Dialysis disequilibrium syndrome occurs when rapid shifts of fluid and solutes affect brain function, often presenting with headache and nausea. Which laboratory value is most important to assess before starting a hemodialysis session? A. Hemoglobin. B. Potassium. C. Sodium. D. White blood cells. Answer, B. Potassium levels must be closely monitored before dialysis because hyperkalemia can cause life-threatening cardiac arrhythmias. A patient's dry weight is 70 kilograms, but post-dialysis weight is 72 kilograms. What does this indicate? A. Excess fluid removal. B. Insufficient fluid removal. C. Normal dialysis outcome. D. Low blood pressure risk. Answer, B. The patient remains above dry weight, meaning not enough fluid was removed during dialysis. What is the main purpose of heparin administration during hemodialysis? A. To control blood pressure. B. To prevent clotting in the extracorporeal circuit. C. To correct anemia. D. To balance electrolytes. Answer, B. Heparin is an anticoagulant used to prevent clot formation in the dialysis tubing and dialyzer. What is the correct needle placement angle when cannulating an AV fistula? A. 15 to 25 degrees. B. 30 to 45 degrees. C. 60 to 75 degrees. D. 90 degrees. Answer, A. A shallow angle, 15 to 25 degrees, is recommended to reduce trauma and ensure proper cannulation into the vessel. Which condition increases the risk of dialysis disequilibrium syndrome? A. First dialysis treatment. B. Long-term stable dialysis. C. Low potassium levels. D. High hemoglobin. Answer: A. First-time dialysis patients with very high urea levels are at greatest risk of disequilibrium syndrome due to rapid solute removal. What is the primary reason bicarbonate is used in dialysate? A. To enhance clotting. B. To buffer blood pH. C. To increase oxygenation. D. To improve potassium balance. Answer: B. Bicarbonate in dialysate corrects metabolic acidosis by buffering blood pH during dialysis. A high-pitched whistling sound at a vascular access site usually indicates A. Normal blood flow. B. Stenosis or narrowing. C. Infection at access site. D. Needle dislodgement. Answer: B. A whistling bruit suggests narrowing of the access, requiring evaluation to prevent clotting or failure. Which electrolyte is most likely to cause muscle cramps if removed too quickly during dialysis? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer: B. Muscle cramps during dialysis are mainly caused by rapid changes in calcium levels and blood alkalosis, which increase nerve and muscle irritability. The most effective way to prevent catheter-related bloodstream infections is A. Frequent saline flushes. B. Strict aseptic technique during handling. C. Increasing heparin dosage. D. Using higher blood flow rates. Answer: B. Aseptic technique is the gold standard for preventing bloodstream infections related to dialysis catheters. If the dialysate conductivity alarm sounds, what should the technician do first? A. Continue dialysis and monitor closely. B. Stop treatment and check the dialysate system. C. Increase blood flow rate. D. Replace the dialyzer immediately. Answer: B. Conductivity alarms indicate unsafe electrolyte concentrations in dialysate. Treatment must be paused until corrected. A patient's blood pressure drops significantly during dialysis. The first step is A. Stop ultrafiltration. B. Give 4 fluids. C. Increase dialysate temperature. D. Stop heparin. Answer: A. Hypotension during dialysis is often due to excess fluid removal. Stopping ultrafiltration stabilizes blood pressure. What is the usual target range for KT/V adequacy in dialysis patients? A. 0.5 to 0.7. B. 1.2 or greater. C. 2.5 to 3.0. D. Less than 1.0. Answer: B. A KT/V of at least 1.2 per treatment is recommended for adequate dialysis. Which hepatitis virus poses the greatest risk for dialysis staff exposure? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Answer: B. Hepatitis B is highly contagious and poses significant occupational risk in dialysis units. Which machine alarm occurs when the arterial line is blocked or kinked? A. High venous pressure alarm. B. Low arterial pressure alarm. C. Conductivity alarm. D. Blood leak alarm. Answer: B. Low arterial pressure alarms indicate poor blood flow due to blockage or needle displacement in the arterial line. What is the role of erythropoietin therapy in dialysis patients? A. Improves vascular access flow. B. Treats renal anemia. C. Enhances calcium absorption. D. Prevents clotting. Answer: B. Dialysis patients often have anemia due to reduced erythropoietin production. Replacement therapy corrects this. Which symptom is an early warning sign of air embolism? A. Shortness of breath. B. Seizure. C. Chest pain. D. Hypotension. Answer, A. Dyspnea, shortness of breath, is often the earliest sign of air entering the bloodstream during dialysis. Which component of the dialysis machine ensures removal of waste without excessive fluid loss? A. Ultrafiltration pump. B. Air detector. C. Conductivity sensor. D. Venous chamber. Answer, A. The ultrafiltration pump precisely controls fluid removal to prevent dehydration or overload. The most accurate method to determine a patient's dry weight is A. Patient self-report. B. Trial and error adjustment over time. C. Measuring blood pressure only. D. Monitoring interdialytic weight gains. Answer, B. Determining dry weight requires repeated adjustments and monitoring of symptoms until the optimal fluid balance is achieved. During dialysis, a patient reports a sudden metallic taste in the mouth and numbness around the lips. What is the most likely cause? A. Hypotension. B. Air embolism. C. Hemolysis. D. Hyperkalemia. Answer, C. A metallic taste and lip tingling during dialysis are classic signs of hemolysis. This may be due to contaminated dialysate, overheated dialysate, or mechanical stress on red blood cells. Immediate discontinuation of treatment is required. A dialyzer shows excessive transmembrane pressure, TMP. What is the first troubleshooting step? A. Increase ultrafiltration goal. B. Check for clotting in the dialyzer fibers. C. Flush the dialyzer with saline and continue. D. Replace the blood tubing only. Answer, B. Excessive TMP usually results from clotting or fibrin deposits in the dialyzer fibers. The first step is to check for clots before considering dialyzer replacement. Which laboratory value must be closely monitored to evaluate dialysis adequacy? A. Serum creatinine. B. KT/V or urea reduction ratio, URR. C. Calcium phosphate product. D. Serum sodium. Answer, B. KT/V and URR are standard measures of dialysis adequacy, indicating how effectively urea and other toxins are cleared during dialysis. A patient becomes restless, short of breath, and develops chest pain during dialysis. The technician notices blood foaming in the venous line. What is the likely emergency? A. Dialysis disequilibrium syndrome. B. Air embolism. C. Myocardial infarction. D. Hypoglycemia. Answer, B. Foaming in the venous line with sudden chest pain and dyspnea indicates an air embolism. The patient should be placed in the left Trendelenburg position, and medical help must be called immediately. Which of the following actions helps reduce the risk of dialysis disequilibrium syndrome in a new patient? A. Use high blood flow rates in the first session. B. Start with shorter and less efficient dialysis treatments. C. Perform rapid ultrafiltration. D. Avoid anticoagulation during the session. Answer, B. To prevent disequilibrium syndrome, which is caused by rapid removal of urea from the blood, new patients start with shorter and less aggressive treatments. A patient with a central venous catheter reports chills and fever during dialysis. What should the technician suspect first? A. Fluid overload. B. Catheter-related bloodstream infection. C. Hemolysis. D. Allergic reaction to the dialyzer. Answer, B. Fever and chills in a patient with a central venous catheter are red flags for catheter-related bloodstream infection, requiring immediate medical evaluation. A patient's venous pressure alarms are repeatedly triggered. What is the most common cause? A. Arterial needle infiltration. B. Kinked or clotted venous blood line. C. Low dialysate conductivity. D. Patient hyperventilation. Answer, B. Venous pressure alarms are often caused by an obstruction in the venous line, such as kinking or clotting, which increases downstream resistance. Which of the following dialysate conditions would most likely cause cramps and hypotension in a patient? A. Low dialysate calcium. B. High dialysate potassium. C. Low dialysate sodium. D. High dialysate bicarbonate. Answer: C. Low dialysate sodium can lead to osmotic imbalances, resulting in muscle cramps and hypotension during dialysis. A patient on dialysis has persistent itching and bone pain. Which lab value is most likely elevated? A. Phosphate. B. Hemoglobin. C. Albumin. D. Sodium. Answer: A. High phosphate levels due to inadequate clearance or poor diet control cause secondary hyperparathyroidism, leading to bone pain and itching, pruritus. Which of the following best describes the function of the dialyzer membrane? A. To provide ultrafiltration by pressure. B. To act as an artificial kidney with selective permeability. C. To control dialysate conductivity. D. To pump blood through the extracorporeal circuit. Answer: B. The semi-permeable membrane of the dialyzer mimics kidney function by allowing selective passage of waste and electrolytes while retaining blood cells and proteins. A patient experiences severe hypotension during dialysis. What is the immediate first action? A. Stop ultrafiltration and place the patient in Trendelenburg position. B. Increase dialysate flow. C. Flush the dialyzer with saline. D. Administer heparin. Answer: A. The priority in managing severe hypotension is stopping ultrafiltration and placing the patient in Trendelenburg position to improve venous return. Which anticoagulant is most commonly used in hemodialysis? A. Warfarin. B. Heparin. C. Aspirin. D. Protamine. Answer: B. Heparin is the standard anticoagulant in hemodialysis to prevent clotting in the extracorporeal circuit. During pre-dialysis assessment, a patient's blood pressure is 190/110 mmHg. What should the technician do? A. Proceed with treatment as usual. B. Notify the nurse or physician immediately. C. Increase ultrafiltration to lower blood pressure. D. Reduce dialysate sodium concentration. Answer: B. A blood pressure of 190/110 mmHg is dangerously high. The technician must notify the nurse or physician before starting treatment. What is the primary role of the hemodialysis technician during treatment? A. Prescribe dialysis medication. B. Monitor patient safety and machine function. C. Diagnose patient conditions. D. Adjust dialyzer membrane size independently. Answer: B. Technicians are responsible for monitoring patient safety, assessing access sites, and ensuring the machine operates within safe parameters, while medical decisions are made by licensed providers. A patient with a fistula reports swelling and throbbing pain at the access site. What is the most likely complication? A. Steele syndrome. B. Infection. C. Thrombosis. D. Hematoma. Answer: C. Sudden swelling and pain at a fistula site suggest thrombosis, clot formation, which can compromise access patency and requires urgent evaluation.